All right, a sit to stand exercise is critical and honestly has the highest return on investment of any exercise that we can do. It helps to engage our hips, our knees, and strengthen us, also in a very functional way. Think about how many times you get up and down throughout the day. So I'm going to introduce the sit to stand and two progressions that you can use, or if you're having trouble with it. It's very simple. You're going to begin with your knees a little bit wider or right around shoulder width apart, toes out a little bit. You don't want your toes directly straight, puts too much tension through the knee. So slight toe out, and then all you do is lean forward, keep your nose between your toes, and squeeze your bottom and stand up. So squeeze your glutes to stand all the way up. If you're having pain in the hip or the knee or the low back, you'll find a lot of times your body will want to kind of stand up around that pain. So when you're doing this exercise without any of our progressions, be aware of your symmetry. So as you're standing up, your nose should stay between your toes. You should drive up thinking symmetrically. Okay? Now, what if your knees are hurting when you do that? You have two options. You can either grab an option or grab an item, a taller chair, and take that chair height up. I've got a foam pad that will add a couple of inches. Just drop that on that chair. All of a sudden, going to sit to stand is a lot less stress on those knees, and I feel a lot less pain. If that's still a problem, you can take a TheraBand, just like you do with like bridges with the TheraBand around the knees. You're going to apply moderate resistance around the knees. Same rules apply. Knees about shoulder width apart, but now the band's pulling this way. So I'm going to have to resist that, and then you just try to stand up like normal. This engages your rear end muscles, your glute muscles more, which actually takes a little tension off the knees and oftentimes can help with that knee pain with a sit to stand. So if you're having knee pain, you have those two options. Make the chair higher, wrap that band around your knees. Okay? As the pain starts to decrease, you can remove one of those options. Make the chair lower, keeping the band, or take the band away and keep the chair height higher. Okay, so make it your own. And then the last progression I want to show is how you really transition this into a strengthening exercise. Once you're out of acute pain, you can actually grab a weight. I've got a 10-pound kettlebell. They're easy to grab and hold on to here. You're just going to hold that right to your chest, and it's going to maintain contact with my chest throughout the whole movement. Same rules apply. Knees about shoulder width apart, toes slightly toed out. I'm going to have my nose just travel right between my feet, and I'm standing up, trying to think symmetrically. The nice thing about the weight is now I have something I can progress. I have a 10-pound. As this gets easier, I can go to a 15. As that gets easier, you can even go into a 20, 25, and really start to challenge yourself. Now, how many do you do? I typically start folks with 2 sets of 8 and gauge your response. You may feel pretty sore the next day, so just pay attention to how your hips, your back, or your knees feel. And if you don't feel anything the next day, go to 3 sets of 8. The most common progression is 3 sets of 8 to 3 sets of 10 to 3 sets of 12. Okay, and once you get there, that means you make the exercise tougher, go back to 3 of 8. It's very a tried and true approach to strengthening. Reach out with any questions. Would love to resource you.